Our third presentation comes from Ignacio Prieto Egido, mind my pronunciation. He's the director of the EHAS Foundation and associate professor at the Rey Juan Carlos University. Ignacio will talk about how BabyChecker can transform prenatal care in rural Guatemala, focusing on how the technology supports early detection and training for healthcare workers in remote settings. Ignacio, the floor is yours.
Hello, everybody, and thank you to the DOLF team for this invitation. I'm really happy to be here with you to share our experience. I will try to differentiate a little bit what I'm going to explain from other colleagues. It's because we are all using BabyChecker, so we can all share a very similar experience, but I will try to focus on what may be different from our side. No? So to start, and this, if you can share the next slide, I work in a team, next slide please, that joins or that puts together people from the university and from the NGOs. No? So, and we work together to verify if the use of innovative technologies can improve public health care in remote areas of developing countries. So previous colleagues have talked about the challenges in these regions, and we try to use innovative technologies such as BabyChecker to improve primary health care in these areas. But we always collaborate with local partners, and we always focus on the public health system. And this is very important in our vision. No? And we always do an important effort to disseminate the results of our work, of our research. So we have already talked about the challenges in these areas, but I want to emphasize that the very low population density, the scarce resources, and the difficulties in transportation and access are part of the challenges. You know? And for the public health system to invest in these remote areas is challenging because of this low population density. Next slide, please. To address the problem of maternal mortality that we have already talked about, we try to develop specific solutions, and we started in rural Guatemala, where maybe the more one of the challenges here is that the density of public health workers is very low. For example, they have 12.5 nurses per 10,000 people, while the HSU standard is around 44.5. So they have a very important lack of health staff, like in other similar countries, and not so high like in Sierra Leone, but still high maternal mortality rate. So in this context, we try to design a strategy to address this challenge. And please, next slide. We started with a strategy that we call healthy pregnancy. And this strategy, we started it like in 2012, so more than 13 years ago. And it's based on two ideas. Now, first, to provide local health staff with tools to improve prenatal control and to be able to diagnose risk during pregnancy. So it's like the same goal as BabyChecker, but we started this, like, as I said, more than 10 years ago. And we started with also a portable ultrasound system that initially used laptops, and currently it uses tablets or smartphones like BabyChecker. But the problem is not only the device, but who's gonna use it. You know? And in our case, we started training nurses in a very basic ultrasound test, where they try to identify common risks like malposition, placenta previa, multiple pregnancy, So also we try to measure the gestational age and also the quantity of amniotic liquid. So we did a very basic and very but quite important ultrasound test to identify this risk and to be able to refer women in risk to a higher level. You know? Instead of having the labor on the community, what means a very important risk for the woman's life, we try to refer them, the high risk cases, to the hospital so that they can be properly attended. And we completed this pregnancy kit with rapid blood and urine tests that tried to identify problems such as anemia, gestational diabetes, urinary tract infections, or in general, sexual infection diseases. And so with this kit, nurses in rural areas were able to provide a very similar prenatal checkup as women will have in the hospital. Not exactly the same, but very similar. For example, we avoid to identify malformations because it's more complex, and also because in rural Guatemala it's not feasible to provide a solution or advice for women in this problem. No? So we focused on the kind of things that can be addressed by the public health system with the resources they have in these rural communities. And as also some colleagues has mentioned, energy is a problem in these areas, and it was even more important 10 years ago. So we provided the system with foldable solar panels and with external power banks to allow them to work in isolated areas without power supply and use this foldable solar panel to charge and power the tablet or the smartphone. And all this system is, you can put it in a backpack like the one in the picture, and you can carry it at your back wherever you go, in motorbike, walking, whatever. No? But also we wanted to follow up and to evaluate this strategy. So we designed a health information system to be able to track every woman that were attended by this project. Yeah? And we started the system with Open EMRs. That is a very famous open source system. And currently we are using the HAS2, that is also very famous and very used in out of countries. And this allows us to improve not only the prenatal checkup, but also the follow-up of the women's in risk. And next slide, please. So as I said, we started in 2012, and we started by training people, by providing kits. We started with 3 kits in 2012. By 2014, we did an evaluation over 1,000 women, and it was quite positive. And then we get funds to scale up to around 30 prenatal kits, and we were able to provide or improve prenatal checkups for around 10,000 women. And with that, we were able to perform a more in-depth evaluation. But the strategy, as I said, was providing the kit, training the women, also to improve the care protocol, because they were not used to have this tool in the rural area. So they needed to have a more clear information on what to do in each case, what to do with each risk, so that the women were properly managed. And so we do a very important effort on training, on following up women with risks, and on coordinating with the public health authorities to improve the whole process and to ensure that women that were at risk had the proper management and that had the best chances to get to the hospital or to the level where they needed to be. No? And And so next slide, please. When we evaluated this strategy, we confirmed first that nurses were able to perform this basic ultrasound and that they reached very good marks on these ultrasound scans, and that more than 90% of the scans had a very good quality for diagnosis. And also we try to evaluate the impact on maternal mortality over this sample of 10,000 women. And when comparing the women that had access to these reinforced prenatal checkups, when we compared this group with the group that had no access to these ultrasounds, we found out that the improvement in maternal mortality was significant, was important. No, around on average around a 30% of reduction in the maternal mortality rate. However, this figure is not statistically significant because we will need a sample of around 50,000 women, and we were only on about 10,000 women. But it shows a trend that is quite relevant for us, and that allowed us to keep working on this strategy with our partners in Guatemala, that is Tula Salud, and with the health ministry, to try to improve and scale up this strategy. You know, currently we have reached more than 40,000 prenatal checkups in Guatemala, and we keep expanding this strategy. And next slide, please. But an important point here is that the staff that performs the prenatal checkups in rural areas, they don't always have the chance to get this training, and to have a more easy to use device could be a very important advance for us. No? So we started to collaborate with Dolph and to use BabyChecker, so that it was easier to handle the highest staff turnover that we found in these areas, and also to provide this tool for the people that work directly in the community, because the nurses are not working in the community, they are working in the health center and they visit the community periodically. But instead, nursing assistants, they work day to day in the community, and they are able to use BabyChecker to improve prenatal checkups every day. You know? So this is a very important opportunity for us, and we started to check this with one device in the last year. Next slide, please. So results in this year are quite promising. We were able to do more than 500 scans with 9 different nursing assistants, and we were able to identify different risks in this sample. No? So we are happy with these results. We think that they show a very promising opportunity, and obviously we will like to try to have more results and to evaluate this strategy in a more deep way. No, because as I said, we have like 40,000 prenatal checkups with the previous solution, and we would like to increase the number of scans also with BabyChecker. Next slide, please. So also we saw that most of the nurse assistants were able to perform good quality scans with BabyChecker, and some of them still need to improve. And in this this also shows that follow-up is very important, even when you are using a very easy to use technology such as BabyChecker. No, keeping following up, keeping reinforcing the training of the staff is quite important, and we are trying to do so. Next slide, please. And what we would like to see or do in the next years, first we have checked that BabyChecker is helping us, and it has a great acceptance among nurses, among nurse assistant, and among the women. And next slide, please. we would like to evaluate the cost effectiveness of this solution, because at the end, public health system needs a very cost-effective solutions again, and we would like to check it again and try to persuade the Ministry of Public Health and Social Assistance of Guatemala to integrate tools like this in the protocols and to be able to scale with more baby checkers and to more nurse assistants, so to increase coverage and to be able to decrease maternal mortality in Guatemala, that is not such as high like in other countries, but it's still higher than the goals of the sustainable development goals. So we want to keep working with BabyChecker. We would like to evaluate the cost effectiveness and to scale up this in Guatemala to reach more women. Next slide, please. And just to end, we do a lot of effort to disseminate the results, and to collaborate in webinars, to publish our results in scientific journals. And that's why we are here today, looking for new partners and new collaborations, and to also let others learn from our experience and be able to replicate what is working. Thank you very much.